Let's get real. People start therapy hoping for a breakthrough, relief, clarity, or a fix. But sometimes months go by and you feel stuck. You're showing up, paying the bill, spilling your guts, and yet your life looks the same. If you've ever thought, is therapy even working? You're not alone, and it's not the end of the road. Here's the truth: therapy is not magic. It's a process, and like any process, it can stall. Sometimes it's because of the therapist. Sometimes it's the approach. Sometimes it's you not showing up fully. If therapy feels like it's failing, it doesn't mean you're broken. It means something in the equation needs to change. But, and this is key, doing nothing and just coasting is the real failure. When people walk into therapy for the first time, many carry an expectation that simply sitting across from a professional will fix everything. It's almost as if there's a hidden belief that the therapist holds some secret formula, and once you share your story, the healing will automatically begin. That mindset sets people up for disappointment because therapy by itself is not a cure. It is a tool. Think of it like joining a gym. Signing the membership contract doesn't make you fit. You have to show up, you have to use the equipment, and most importantly, you have to push yourself through the discomfort of growth. Therapy works exactly the same way. The sessions, the conversations, and the insights are resources, not instant remedies. When we call therapy a tool, what we mean is that it's designed to help you process challenge and reshape the way you think, feel, and act. A hammer doesn't build a house. A paintbrush doesn't create a masterpiece by sitting in the jar. They have to be used intentionally, repeatedly, and with effort. If you only show up once in a while, or you use the wrong tool for the job, the result will be frustration. People sometimes say, therapy didn't work for me, when what actually happened is that they treated therapy like a cure, something that would magically erase their pain, rather than a tool which requires practice, persistence, and active involvement. This misunderstanding is common because pain makes us desperate for relief. When someone is anxious, depressed, or struggling in a relationship, the idea of just going to therapy sounds like a solution, and in fairness, therapy is powerful. But it can't carry you if you don't walk with it. Imagine having a prescription but never taking the medicine as directed. Therapy is like that prescription. You need to engage with it between sessions. Apply the strategies, track your triggers, challenge your thoughts, and make behavioral changes. If you treat it as a place to simply vent your frustrations without committing to action, the experience will feel like spinning your wheels in the mud. You might feel a little better temporarily, but nothing will really change. It's important to understand that therapy is not a replacement for personal responsibility. A therapist can guide you, reflect your patterns back to you, and equip you with tools, but they cannot live your life, have your hard conversations, or make your choices. Too many people subconsciously expect their therapist to carry the load for them. That's not how it works. If you want therapy to be effective, you have to come prepared to own your part of the process. You have to be willing to do the uncomfortable homework, the awkward journaling, the practice of new coping skills, and the honest examination of your own blind spots. Another angle to look at is that therapy is not the only tool. If you were building a house, you wouldn't only use a hammer. You'd need saws, drills, levels, and measuring tape. In the same way, therapy might be one of several tools you need for healing. Exercise, nutrition, support groups, spiritual practices, coaching, or even medication can all play roles. Believing that therapy alone will solve everything is like expecting a single screwdriver to build a skyscraper. The reality is more complex, and that's okay. It doesn't mean therapy is ineffective. It means it has a specific function that works best when combined with other efforts. Some people also confuse relief with results. They may feel a temporary sense of calm after a session and think, great, I'm cured. Then the next week, the same problems resurface, and they get discouraged. That's like feeling sore after one workout and deciding you've finished your fitness journey. Real change requires repetition and reinforcement. Therapy is meant to train your mind and emotions, not perform a one-time miracle. The sooner you embrace that mindset, the sooner you'll stop waiting for therapy to fix you and start using therapy to empower you. If therapy is a tool, then you are the builder. You decide what to build, how much effort to put in, and whether you'll keep going when it gets tough. That's empowering because it means you're not a passive patient waiting for healing to be delivered to you. You're an active participant shaping your own growth. The therapist is more like a coach or consultant. They can't play the game for you, but they can point out your blind spots, offer strategies, and hold you accountable. And if you start thinking this way, you shift from dependency to agency. You stop asking, why isn't therapy working for me? And start asking, how can I use therapy more effectively? The bottom line is this: therapy is a tool. And like any tool, it's only as effective as the hands that wield it. If you treat it like a cure, you'll be disappointed. If you treat it like an opportunity, you'll be transformed. It requires honesty, discipline, courage, and follow through. When you accept that, you stop waiting to be rescued and start learning how to rescue yourself. That's when the real progress begins, not just in the therapy room, but in every area of your life. When people wonder why therapy isn't delivering the change they expected, the issue often boils down to three simple but powerful variables: effort, fit, and method. These are the pillars that determine whether therapy produces meaningful results or stalls out. If even one of them is missing or misaligned, progress slows dramatically. The good news is that each of these variables is within your awareness and, to a large extent, within your control. Understanding them and being honest about where the breakdown is happening is the difference between staying stuck and moving forward. Effort is the first variable, and it's the one that people most often underestimate. Therapy isn't a passive process where you sit back and get fixed. It requires a willingness to engage deeply, to tell the truth, and to do the work between sessions. Think of therapy like school. You can show up to class every day, but if you never study, never complete the assignments, and never prepare for exams, you won't learn much. Likewise, in therapy, simply attending the sessions is not enough. The real transformation happens in the days between those sessions when you practice the coping strategies, apply the insights, and challenge your old habits in real-world situations. Without effort, therapy becomes little more than an expensive conversation. With effort, it becomes a training ground for growth. That effort also means being willing to face discomfort. Progress rarely comes from talking about the easy things. It comes from shining a light on the painful, the shameful, and the vulnerable. Many clients resist in those deeper places, or they stop when they feel emotional resistance. But the breakthrough is often on the other side of that discomfort. If you're not willing to push yourself, therapy may feel like it's not working, when in reality, it's your own unwillingness to lean into the hard work that's holding you back. No therapist, no matter how skilled, can do that for you. Next comes fit, which refers to the relationship between you and your therapist. Therapy is built on trust and rapport. If you don't feel safe with your therapist, if you feel misunderstood, or if you're clashing with their style, it's like trying to run a race with a pair of shoes that don't fit. You might keep moving, but it's going to hurt and you won't go far. Fit doesn't mean the therapist is bad or you are difficult. It simply means that human beings connect differently. Some therapists are more nurturing, others more direct. Some lean into listening while others emphasize action. If you need structure and your therapist is laid back, you may feel unsupported. If you need gentleness and your therapist is blunt, you may feel attacked. Neither style is wrong, but for therapy to be effective, the style must match your needs. Many people stick with a therapist out of politeness, fear of starting over, or guilt about firing someone, but staying with a poor fit is costly. Every session you spend in misalignment is a session you could have invested in someone who truly gets you. It's not quitting to switch therapists, it's advocating for yourself. Fit is so essential that research shows the therapeutic alliance, the quality of the relationship between therapist and client, is one of the strongest predictors of success. That means it's not just about the techniques used, it's about whether you feel understood, supported, and challenged in a way that motivates you. Finally, there's method. Therapy is not one size fits all. Just as you wouldn't use the same treatment for a broken arm and high blood pressure, you can't expect every therapeutic method to solve every issue. Some approaches are designed for specific problems. Cognitive behavioral therapy, a CBT, for example, is evidence-based for anxiety and depression, but it may not go deep enough for someone processing childhood trauma. Eye movement desensitization and reprocessing, EMDR, can be powerful for trauma, but it may not be necessary for someone working on communication skills in their marriage. If the method doesn't match the problem, therapy can feel like you're running in place. This is why it's so important to ask questions and be informed. You are allowed to ask your therapist why they're using a particular approach, what evidence supports it, and how it connects to your goals. If you've been in therapy for months and nothing has shifted, it may not mean you're hopeless. It may mean the method isn't the right fit for your situation. And just as you might seek a second opinion from a doctor, it's wise to explore other therapeutic approaches or practitioners if you're not getting traction. When you look closely, you'll see that effort, fit, and method don't stand alone, they work together. If you're giving full effort, but the therapist's style is a poor fit, progress will stall. If the fit is strong, but the method doesn't address your issues, you'll feel supported but not transformed. If the method is excellent and the therapist is skilled, but you're not putting in effort, the results will still be limited. All three variables must align for therapy to feel effective. The reality is that many people blame therapy itself when they're frustrated, but the smarter move is to ask, where's the breakdown? Effort, fit, or method? Once you identify which piece is missing, you regain control. You stop labeling yourself as unfixable and start troubleshooting the process. Therapy is a collaboration, not a transaction, and the sooner you recognize that these three elements matter, the sooner you can make the adjustments that unlock real progress. One of the biggest reasons therapy stalls isn't that the therapist lacks skill or that the client is incapable of change. It's that the client holds back from being direct. Too many people sit in therapy week after week without ever saying the most important thing, what they actually want, what they actually need. and what they actually feel isn't working. They stay polite, they nod along, they go through the motions, and then they leave frustrated because the sessions don't seem to move them forward. The irony is that therapy is one of the very few spaces in life where you are encouraged to speak openly and honestly, yet many clients bring the same patterns of people-pleasing avoidance or vagueness into the therapy room that keep them stuck in the outside world. Being direct in therapy doesn't mean being rude or confrontational. It means being clear and unapologetic about your goals, your needs, and your frustrations. Let's start with goals. If you walk into therapy with nothing more specific than, I just want to feel better, you are setting yourself and your therapist up for a very difficult road. That's like telling a personal trainer, I just want to be healthier, without mentioning whether your priority is strength, weight loss, or endurance. A therapist can support you much more effectively when you articulate a concrete outcome. For example, saying, I want to reduce my panic attacks from weekly to monthly, or I want to rebuild trust with my partner after betrayal, or I want to develop boundaries with my family without feeling guilty. These are specific goals. They give both you and the therapist a target to work toward. Now let's talk about needs. Therapists have different styles, and sometimes their default approach doesn't match what you require. Maybe your therapist is very passive and lets you lead, but you actually need someone to challenge you more directly. Maybe your therapist focuses on insight and reflection, but you need tools, structure, and homework. If you don't say what you need, you leave them guessing. Being direct might sound like, I'd like more practical strategies I can use outside of sessions, or I need more accountability on whether I'm following through. These aren't criticisms, they're clarifications. They help the therapist adjust their approach so the therapy works better for you. Then there's frustration. This is the hardest one for people to express because they don't want to offend their therapist. But therapy is your investment, your time, and your journey. If something feels off, it is not only appropriate but necessary to voice it. For example, if you feel like you've been circling the same topics for months without progress, say it. If you feel like your therapist doesn't challenge you enough, say it. If you feel misunderstood or unheard, say it. A good therapist will not take it personally. They will use that feedback to realign the process. And if they do take it personally, that's useful information for you too, because it may signal that the therapeutic relationship isn't the right fit. The reason directness is so crucial is that therapy is collaborative. Your therapist isn't a mind reader. They can observe patterns, but they cannot know exactly what you're thinking unless you tell them. If you hold back your real feelings or hide your dissatisfaction, you rob yourself of the opportunity to improve the process. It's like going to a restaurant, receiving the wrong dish, and eating it quietly while resenting the experience. The problem isn't that the restaurant failed, it's that you didn't send the dish back and ask for what you actually ordered. Being direct in therapy also trains you for the rest of your life. Most people struggle with assertiveness outside of therapy. They don't tell their partner what they really want. They avoid conflict at work. They pretend to be fine with things they're not fine with. Therapy becomes a practice ground where you can experiment with telling the truth in a safe space. If you can say to your therapist, this isn't working for me, here's what I need, you're building the muscle to say the same in your relationships, your career, and your daily life. In that way, being direct is not only about improving therapy, it's about rewiring the way you communicate in general. Of course, there's fear attached to this. Many clients worry, what if I hurt my therapist's feelings? Or what if they think I'm ungrateful? That fear comes from old conditioning. Most therapists welcome honesty because it allows them to do their job better. And if you think about it, if your therapist can't handle direct feedback, how are they supposed to help you handle it in your own life? Therapy should be the safest place to say exactly what's on your mind. Another subtle trap is assuming the therapist always knows best. Yes, therapists are trained professionals, but you are the expert on your own life. You know when something feels useful and when it doesn't. Directness means honoring that knowledge. You don't have to blindly accept everything suggested. You can push back, ask for clarification, or propose alternatives. For example, I don't think journaling is working for me. Can we try another strategy? That doesn't mean you're disrespecting their expertise. It means you're taking ownership of your growth and shaping the process to actually work for you. At the end of the day, being direct in therapy is about accountability. It's about refusing to be a passive passenger and instead becoming an active participant in your healing. Your goals give direction. Your needs guide the method. Your frustrations highlight what must change. If you're not speaking these out loud, you're handicapped in the process. But when you do, you not only unlock more effective therapy, you also reclaim your power in every area of your life. Ownership is the cornerstone of change. No matter how skilled your therapist is, no matter how many sessions you attend, and no matter how many techniques you try, the responsibility for healing ultimately rests on you. That statement can feel heavy at first because it strips away excuses. It means you can't simply outsource your well-being to a professional and expect them to deliver transformation. But it's also incredibly empowering because it means you're not helpless, you're not dependent on a single person or process, and you have far more control over your growth than you may realize. Taking ownership starts with rejecting the fantasy that therapy will do the work for you. Many people unconsciously treat therapy like dropping off their car at a mechanic. They think, I'll show up, describe the problem, and the therapist will fix me. That mindset keeps you stuck because it assumes your passive object being repaired. Healing doesn't work that way. You are not a car. You are an active, thinking, choosing human being. Therapy provides tools, insights, and guidance, but only you can apply them in the messy reality of your daily life. Ownership also means recognizing that your therapist cannot want your healing more than you do. A therapist can encourage, challenge, and support you, but they cannot make you take the steps. They cannot stop you from self-sabotage. They cannot make you have the hard conversation with your partner or push you to break that toxic habit. If you aren't fully invested, therapy becomes an expensive form of procrastination. Owning your healing means showing up with commitment, not just attendance. It means deciding, I am the driver of this process, not the passenger. Another part of ownership is embracing accountability for the choices you make outside of therapy. What you do between sessions is just as important, if not more important, than what happens during the sessions themselves. You can talk about boundaries in the therapy room, but if you go back home and continue saying yes to every demand placed on you, nothing changes. You can process trauma in therapy, but if you still numb out with substances or avoid the real issues, the cycle continues. Owning your healing means acknowledging that the biggest arena for growth isn't the 50 minutes in the office, it's the 23 hours and 10 minutes of the day when you're living your life. It's also important to understand that therapy is just one path, not the path. Some people get stuck because they've convinced themselves that therapy is the only legitimate route to healing. When progress stalls, they feel doomed. But healing can come through many avenues: coaching, support groups, spiritual practices, self-study, journaling, lifestyle changes, or even medical interventions. Therapy can be a powerful anchor, but it's not the whole ship. Taking ownership means being willing to explore multiple resources rather than clinging to one method out of fear or convenience. It's about building a toolbox rather than putting all your hope in a single tool. Taking ownership also involves changing the way you tell your story. People who resist ownership often frame their life as something that happens to them. They say, my partner makes me feel worthless, or my boss stresses me, or my parents ruined my confidence. Those statements give all the power to others. When you own your healing, you shift the language. I feel worthless when I don't set boundaries with my partner, or I allow my boss's criticism to define my self-worth, or I'm working to rebuild the confidence my parents didn't nurture. That shift in language is subtle but crucial. It stops painting you as a victim and reframes you as someone with agency. Of course, ownership doesn't mean blame. If you've experienced trauma, abuse, or injustice, you didn't cause those things. You are not responsible for what happened to you. But you are responsible for how you respond now, how you choose to heal, and whether you allow the past to dictate your future. Ownership is not about fault. It's about freedom. It's about saying, I didn't create this wound, but I refuse to let it control me. I will take responsibility for my recovery. The biggest payoff of ownership is that it gives you back your power. As long as you believe your healing depends entirely on your therapist, your circumstances, or other people changing, you stay powerless. The moment you take ownership, you reclaim control. You stop waiting for rescue and start building resilience. You stop asking, when will this get better? And start asking, what can I do to make it better? That shift changes everything. Ownership also requires consistency. It's not about one big decision to take control of your life and then coasting. It's about daily choices, getting up when you don't feel like it, practicing new skills even when they're uncomfortable, and holding yourself accountable when you fall back into old patterns. The more consistent you are, the more momentum you build, and the more therapy becomes a partner in your progress rather than a crutch you lean on. At the end of the day, taking ownership is about deciding to stop outsourcing your power. Therapy can be a guide, but you are the one who has to walk the path. Healing is your responsibility, which means it is also your victory. When you truly grasp that, therapy stops being a lifeboat you cling to and becomes a compass you use to steer your own ship. And that is when real, lasting transformation begins, not because someone else fixed you, but because you chose to take control and build the life you deserve.